Thank you all. I see we have 74 total participants, 63 attendees on right now. So thank you guys for joining us. We're super excited to have you with us this afternoon. My name is Morgan Falgu. I am the supervisor of the Career Outreach Team, which is a part of talent acquisition here at Ochsner Health. And our team facilitates these great talent talks to let our community know more about the great work going on at Ochsner. So I'm excited to have everyone with us today, and I hope you learn a little bit more about this new and exciting health center that we're opening in New Orleans East. So first, I would like to go ahead and introduce all of our panelists that are going to be speaking today, that we're going to be asking questions to. These are our subject matter experts in the field. So first, I'm going to go ahead and introduce our Ochsner team members that are joining us. So Kim, you want to go first and introduce yourself to all of our call participants?
Thank you, Morgan. Hi, I'm Kim Keene. I'm the Chief Executive Officer for St. Bernard Parish Hospital, and I'm glad to be here and to discuss our new initiative that'll be out in New Orleans East.
Thank you, Kim. Next up, I have Dr. Laborde. You want to go ahead and introduce yourself?
Hey, good afternoon. Thank you, Morgan. It's a pleasure to be here. I'm Dr. Evance Laborde. I'm the Medical Director for Global Health Education at Ochsner. Also serve as Assistant Professor for Internal Medicine for our UQ Clinical School, and actively involved in our community outreach and community testing activities.
Next up, I have Dr. Nguyen. You want to go ahead and introduce yourself?
My name is Tan Nguyen. I'm a cardiologist here at Baptist. We'll also be rotating throughout with the new health center. So thank you for the opportunity to be here.
Thank you, Shannon. Next up, we have Rick Mallard. Rick, you want to go ahead and introduce yourself?
Sure. Well, good afternoon, everyone. My name is Rick Mallard, and I currently serve as the Regional Recruitment Manager for Ochsner's South Shore Community Facilities and Managed Entities. So we have a team of 7 recruiters that support St. Bernard Parish Hospital, St. Charles Parish Hospital, Ochsner Medical Center Kenner, Ochsner Medical Center West Bank, and the Ochsner Medical Center clinics located throughout the area, including our new community health center in New Orleans East.
Thank you, Rick. So that's all of our excellent panelists from the Ochsner team. As you can see, we have a diverse group of leaders that are joining us. They're going to be answering some great questions about the opening of this health center, as well as Ochsner's commitment to community well-being, specifically in the New Orleans East area. We're really excited about that. And then also joining us is Cindy Nguyen, council member from District D. We're super excited to have her here. And before we even get into the questions and answer session from our panel, council member wanted to give just a brief overview of how excited she is for Ochsner to be coming into the community. So you want to go ahead, council member Nguyen?
Well, first of all, I just wanted to say thank you to the Ochsner team for putting this talent talk together. It's unique, but I think it's really cool to create an opportunity for potential individuals that may be joining the Ochsner team to kind of get to know more about Ochsner. The second thing, I also wanted to take this opportunity to thank all of your healthcare workers who have been responding to the COVID-19 and making sure that our citizens are safe and that they're getting the proper health care. So hats off to you guys for being part of that work in making sure, again, for the city of New Orleans. I know we partner on a couple of COVID testing in District E. And so I definitely want to thank you guys for that partnership. But more and more importantly, we're here today is the grand opening of the New Orleans East Ochsner Clinic. And I have some thoughts, and as I prepare my notes for this event, one of the things that before you guys actually decided to build this beautiful clinic, the community itself been dealing with blight. When you have blighted property, you have all sorts of unnecessary things that happen. And so with the New Orleans East Ochsner Clinic, you guys have helped us remove a large piece of blighted property off of our main corridor, which is off of Bullard. And so I want to thank you for that. Another thing I also wanted to thank you guys for is because of your investment into our community. You have actually played a role in boosting up excitement and really encouraging other individuals, other groups, other investors to invest into the community because nobody wants to go first. And I want to thank you guys for also joining the path of several developments that have been taking place in District E. And because of that investment, you will help me and my team in the city of New Orleans to continue to attract potential development that's going to improve the quality of life for the families in the East as well as in the city of New Orleans. Access to healthcare for our local residents is really critical. I think in times of COVID-19, we recognize that as firsthand. The East is very fortunate to have the New Orleans East Hospital. We are also welcoming you as another healthcare partner in the East to make sure that local residents continue to have local access to healthcare. And I hope that and I know with New Orleans East Hospital, Ochsner, people may say, well, they are competitors, but I know that you guys have worked together in partnership, particularly during the time of COVID. And I hope that that partnership will continue as we move our district forward, as we continue to make sure that residents in the community will have the best quality of healthcare provided in our community. And most importantly, the reason why we're here today is to create access to job opportunities. We just received news yesterday that roughly about 19,000 people that are still unemployed in the state of Louisiana. COVID-19 has created an unexpected, unprecedented of people losing their job. Many people didn't realize that in March that they may potentially lose their job. And so having this opportunity during this time, it is extremely powerful, and to give many residents in our community the hope and desire that you will be able to get back on track. So with that, I want to thank you for allowing me to be part of this panelist. I am excited to hear from all of the individuals that are on the panelists, and definitely would love to get some feedback from those that are participating in this talent talk. So again, thank you very much, Morgan.
Yes, no, thank you, Councilmember Nguyen. We're very grateful to have you here and to share your excitement for Ochsner joining the community. I really love that you spoke specifically about access to care for all of the community members in New Orleans East. We really want to make sure that we're able to provide care for that community and be able to give access to the New Orleans East region in a way that Ochsner hasn't been able to do before. So with that, Dr. Nguyen, if you can kind of share, I know you have lots of experience working in the New Orleans East community as a cardiologist and then now joining the Ochsner team. You can kind of share your thoughts about the opening of this health center and what it's going to do for the community in terms of providing access to critical care resources.
Sure. Thank you, Morgan. So as you said, having served that particular community since 2007, we definitely recognized that the community deserves accessible and comprehensive health care, starting with primary care. We can provide a range of services from routine annual health exams to evaluate and treat common conditions such as high blood pressure, diabetes, hypertension. And then if indicated, the primary care physician can refer to our specialists. For example, if they have a cardiac condition, they can see one of us who can definitely take care, evaluating, making the diagnosis and the treatment of any cardiac issues. Cardiac diseases such as coronary artery disease, peripheral vascular disease like poor circulation, or any rhythm disorders. And we're capable of doing the diagnosis at this new clinic with our new equipment. Also, I wanted to mention that during the COVID pandemic, we've also increased our telemedicine visits. So patients who are afraid to come in, they have the opportunity to visit a physician by video or audio safely from their home. And also with the Ochsner system, they have digital medicine where patients can, for example, monitor the blood pressure at home, and the results are sent directly to their doctor, who can adjust the medication as necessary. Also within the Ochsner system, once their patients are in the Ochsner system, they have access to other Ochsner system within the region, not just in the state.
Thank you. I think that was a great, well-rounded answer of all the great resources that you're going to be able to provide for the region. So thank you for that response. Speaking of the opening of this community center, Kim, I want to direct this next question to you in terms of how the new community health center is going to be working in partnership with St. Bernard Parish Hospital, which you lead.
Thank you, Morgan. Well, St. Bernard Parish Hospital will, along with Ochsner Health, will ensure that we are providing comprehensive care. We're going to meet the needs of the community. And if we decide that the community has needs for certain specialties, we will add those specialties to the community health clinic. This is a great opportunity to be able to have local access to care. Also, with the close proximity of St. Bernard Parish Hospital, if you need additional testing, you need to have hospitalization, we're here for you, and you can remain in the system that is able to serve you as well as you need and whatever your needs may be.
Yeah, I think it's going to be an excellent partnership for all of community members in that region. Thank you, Kim. Speaking to the opening of the new health center, Dr. Laborde, I'm going to address this question to you. With this health center opening, we're here to talk about an array of job opportunities for those living in the community or those that want to relocate to the community. Can you touch on the benefits for a primary care provider role in this type of setting with Ochsner Health, specifically working in community health?
No, thanks, Morgan. That's really a very good question, and it kind of dovetails to the comments that Dr. Wen made and also that Kim made. The fact that this type of an approach where you're able to provide comprehensive care in a setting whereby you're supported by a system such as Ochsner, who's got a long history of providing comprehensive and integrated care, it does open up a significant opportunity for a primary care physician who has a desire to be a community-based physician who has a desire to provide services to an underserved area. So what it does, it opens up a tremendous opportunity for that physician to come and be part of a healthcare model that's actually well established. In terms of primary care, our primary care system here at Ochsner, it's a coordinated, integrated care system whereby our focus is really patient-centered. And so it really provides that physician an opportunity to be connected to the services that Ochsner provides through, again, we have through our Epic system as well. And so the beauty about it is that at this point in time, opening up a center like this in a community such as the New Orleans East community where there's a significant need, because there are some providers who actually have a desire to provide care, community-based care in areas that are underserved or who are in need of access. And so what this does for us, it actually provides us another option for those types of physicians who are committed to community and to service to become and be part of a really comprehensive, integrated primary care service practice that has all the necessary support system to ensure that they can come and be totally focused on doing the thing that they've actually trained to do, and that is to focus on the care of and the well-being of their patients, while we have the organizational structure and the support to make sure that they have all the support that they need so that their focus is first and foremost taking care of their patients. So again, I'm a little bit advanced in my career, but I have a passion for community care. So if I was early on, this would be an ideal position or role for me to apply for, to be in the East and work with Dr. Tan.
Good. No, thank you. And I would definitely say we've talked a lot about access to care, specifically for our patients in this community and how they have all the resources of the Ochsner Health System. Before we want to go into this next question, I'm going to kind of make a shift to talk about the culture. But before we jump into it, I just want to remind all of the attendees on the call that you can ask a question down at the bottom of your screen. There's a Q&A option where you can chat with us, let us know specifically what you want to learn about, and then we're going to take those questions at the end. We also have the chat feature up if you want to send a chat, but we recommend just putting your questions in that Q&A section so we don't miss it at the end of the call. So to kind of transition, as I mentioned, I want to go over culture of the organization and some of the benefits of being an Ochsner employee. Kim, I know you've been with the organization for quite some time. Do you want to share a little bit of your viewpoint on the overall culture of Ochsner Health and what you find to be a benefit for our employees?
Thank you. Yes, I would like to talk about it. Really, the benefits of being an Ochsner employee is really endless. And one of the things that I appreciate the most about being an Ochsner employee is it really addresses my missions and my values. So you have an opportunity to do things and be a lifelong learner, have the opportunities to work in different areas or regions. If your personal life changes and you're relocating to another place within the state or even outside the state, you can still remain an Ochsner employee and have the benefits of all the education that's available. There's opportunities to be part of a larger system, which I think really makes it wonderful, so that your mission and your values that you have as an employee, also as a person, you can carry that as being part of the larger system. It is nice to be part of that larger system, which was really emphasized in COVID. We all stuck together, we all helped each other, and it's something that makes me proud to be an Ochsner employee.
Yes, absolutely. And we're going to talk about COVID a little bit later, but I think we've all been able to kind of band together during that time to just see the benefits of the organization. And as an employee, just getting that consistent communication. I definitely agree with you. I'd also like to have Shannon answer this question. I think Shannon works in a very unique part of the organization where she's able to really assist our employees in growing their career. So Shannon, you kind of want to talk about some of the benefits of being an Ochsner employee specific to career growth and development?
Absolutely. So one thing that we're very excited about at Ochsner is that we're able to bring in folks at an entry level, but absolutely help them grow through a pathway of employment within our organization. You can come in as a medical assistant and absolutely take advantage of opportunities to become an LPN. We are looking to grow folks because we're excited about them. We're excited about what they can offer to the organization and being committed to one another in that area of growth. So there are absolutely a plethora of opportunities for pathways of growth within the organization.
Thank you, Shannon. And we're going to talk a little bit more about how you can start in an entry-level position and grow your career a little bit later on the call with Shannon again. So I want to transition back to COVID. I think that's something that's clearly on many people's mind right now, whether you work in healthcare, whether you're wanting to transition your career to healthcare. It's, very current topic and something that we're constantly learning and growing, how to care for our patients and our employees during this time. I want to direct this question specifically to Dr. Laborde. Can you specifically speak to the organization's COVID response and how our frontline heroes are making a huge impact on our patients and the community as a whole?
Oh, no, thank you, Morgan. I think Kim had actually mentioned about the sense of pride of being part of Ochsner, and I think our response to the COVID-19 really kind of highlighted all the positive and strengths of a system as large as ours and how committed we are to the well-being of the community. So one of the things that's really critically important for us as a system, we really have this motto, at least that I've actually purported, is this idea that global health is local health. And so what this COVID-19 revealed is that there really are no borders when we think about both communicable and non-communicable diseases. And I think Ochsner, being rather progressive in its thoughts and mindset, it always had a global view of health and really had a fundamental understanding that really diseases do not respect borders. And so specifically with COVID-19, when it presented, as you all remember, I think the first case of COVID-19 was on March 9th, and then we quickly became really a hotspot nationally. I think at one point in time, we actually had the highest rate of any other state in the country. And so Ochsner, what we're able to do in terms of, we're able to mobilize our resources and our forces in such a way that we were able to use our strength as a system. First of all, on the inpatient side, both our ED and our ICU, and as well as the care that we provided within the hospital, was structured in such a way that we could accommodate and adjust the influx of patients because of the wide specialty care that we provide. And so on the forefront, we were actually at one point, in terms of the number of ICU patients, we had the most ICU patients in the hospital, as well on the inpatient side as well. We restructured our ED. And so we're really a focal point where the whole community depended on us. We're able to actually come through in that regard. And so once we were actually able to play a significant role in managing the acute phase, then it came back to planning as to how do we use our resources and partner with the community to make sure that we continue to contain the virus. And so that's one of the things that we've actually been actively involved in, is in from a community perspective, making sure that we've actually provided support and access for local communities that wouldn't necessarily have access to testing. And so back in May, we initiated this community testing program, and we've actually done over 60,000 tests. And so we're using our geospatial capabilities that allow us to kind of monitor the propagation of the disease and partner with both the state and the city so that we could actually target resources and be able to monitor increases in terms of infectivity rate and hospitalization. So we were able to use all our resources, both technical, operational, to put that in place to help us really effectively mitigate and manage the propagation of disease. So that's one of the significant advantages that we have as a health system, to be able to contribute and partner in such a way to ensure that we make sure that our communities and our patients are actually optimally cared for.
Thank you, Dr. Laborde. I think, you just spoke to the amazing work that the organization has done, for the community, and then as well as the state to provide access to testing. I know you've had a heavy role in leading that specific project. So just really grateful for you for doing all of that to kind of lead the charge for everyone. So now kind of to shift.
Yeah, I'll just add one more thing if I could.
Yeah, go ahead.
So one of the things that people actually realize is the extent amount of research that we actually do here at Ochsner. So we actually, in response to COVID, we have 35 ongoing clinical trials testing a lot of the new medications and interventions. And in fact, we recently started a vaccine trial, the Pfizer mRNA trial. We're actually one of 120 sites that have been chosen worldwide to participate in that study. So I think that's one of the things that oftentimes we're not fully aware of, and people are not fully appreciative of the amount of research and work that's being done on the front line. Frontline research is being done in order to address and provide us a cure and long-term treatment and intervention for the COVID. So just wanted to share that.
Yes, which I think is an excellent point to add. And thank you for sharing that. We greatly appreciate it and all of your expertise. So I'm going to transition a little bit to career, just to transition to career opportunities for everyone joining the call. As Councilmember Nguyen stated at the beginning of the call, this is going to provide not only access to patients, but career opportunities for people living in the New Orleans East region when we open this community health center. So Rick, I want to transition to you and have you answer these questions. What are some of the new career opportunities that'll be available for this specific location?
Well, that's a great question, and it's the $1 million question that we were asking when we were talking about this recently. So, I mean, we are super excited to have this chance to provide new employment opportunities to the New Orleans East community and all of the surrounding communities. Our new community health center will have a variety of roles available, whether you're just starting out in your career, seeking the next challenge or path in your current field, or seeking a leadership or professional type role. We're already actively recruiting for medical assistants and licensed social worker opportunities through our career website at ochsner.org/careers. You'll also find nurse practitioner opportunities available if you're seeking an advanced professional nursing opportunity. Recruitment will begin in the coming days and weeks as well for LPNs, security officers, patient access representatives, and additional roles will be available, just like Kim mentioned, as services and programs expand in the clinic as we move through the fall and into 2021.
Thank you, Rick. And I know that you're speaking to jobs available at our community health center that's opening in the coming months. What about other opportunities available within the region for those looking to join Ochsner Health?
Oh, of course, and there are a lot. So there are, currently hundreds of roles available for job seekers with various skill ranges and shift preferences, whether you're looking for full-time work, part-time work, PRN work, day shift, night shift. We have a lot available. Our neighboring partner facilities, to include Slidell Memorial Hospital, Ochsner Medical Center North Shore, Ochsner Health Center Covington, and St. Bernard Parish Hospital, are actively recruiting today. Roles would include environmental service, dietary services, community clinic temperature checkers, patient access reps, security officers, medical assistants, patient care technicians, patient sitters, licensed practical nurses, and registered nurses as well. And I'm sure, the question that some of you may have is, how do I apply for one of these opportunities? It's super easy. Job seekers can connect with Ochsner in a variety of ways, which I'll just highlight real quick. The first thing you can do, if you're out there right now thinking about applying for one of these opportunities, join us for our online virtual career fair. We'll be getting together next Wednesday, August 19th from 11 a.m. to 1 p.m. And that's where you can actually interface with our facility recruiters and career specialists and chat with them one-on-one about our career opportunities and all of those areas mentioned, plus some other ones that I didn't have the time to mention. You can always follow us on social media. We are very active on Facebook, LinkedIn, and Instagram. If you just search careers at Ochsner. You can, again, visit our career page at ochsner.org/careers. And the cool thing about that site, you can search jobs by keyword, title, and regional location. So you don't have to scroll through thousands of opportunities. You can really highlight the area you live in and or the role that you would like to fill. And then finally, our chat feature is always available 24/7, where you can chat with a representative from our team. We'll walk you through the application process and a few easy steps.
Thank you, Rick. I greatly appreciate that. And just so everyone knows, we're going to put up more information about the virtual career fair next week at the end of the call. So that way you can have access to the link to sign up for it. And we'll drop it in the chat feature. So just want to go ahead and we'll do that later once we finish with the panel questions and while we're doing the Q&A. So now I want to transition. I think Rick spoke about tons of career opportunities. As you can see at Ochsner, we're hiring a variety of roles at all times across all locations. But I want to go back to Shannon, as you talked about beginning your career and coming on and learning an entry-level skill and then growing through the organization. Can you speak specifically to some of the workforce development programs that we have available to those interested in beginning a career in healthcare?
Absolutely. Thanks, Morgan. So, yes, we are very excited because our workforce development programming actually, it works to connect members of our community to Ochsner with allied health positions in mind. We're saying that we look to help to educate and train individuals to become part of the Ochsner family, to be able to work in areas, as I mentioned before, like medical assistant, as well as LPN, medical lab technicians. We also have opportunities for medical coders, and that's the beginning of opportunities that we look to be able to connect individuals with. And understand, when we're talking about the education and training part of it, it is not only to get you trained, but to also ensure that you're in a position to become hired and become a member of the Ochsner family. You will go through training with partnerships that we have within the community, such as Delgado, and literally you walk away with an industry-based credential. Those credentials can assist you not only in employment here in Louisiana, but they carry with them a national transportable piece with them as well. So you can go to work anywhere in the country, but of course we would like for you to stay with Ochsner and become an integral part of what we do every day. But it's an exciting time for us, building partnerships throughout the community, ensuring that we're getting folks aware of what we do, and helping folks to really find that niche where they should be and where they're going to be the most happy, not only in their professional careers, but also where we can assist in their growth as well.
No, absolutely. I think one of the most exciting parts of these workforce development programs is that you're able to get these job readiness skills and specific certifications and trainings, like you mentioned, where you could go work anywhere and begin your career. And I think that's such a huge benefit and no cost to the individual going through training. What are some of the other incentives, though, of joining this program? I know there's so much more than just the job training.
So one thing I could tell you that makes it unique for us, we offer wraparound services within each of our workforce development programs. What that means is we're looking to absolutely attend to the comprehensive needs of our participants in our cohorts, and I'll talk a little bit about cohorts in a second. But what happens there is life gets in the way sometimes. We recognize that we have barriers to employment as well as barriers in maintaining employment. One thing about these particular programs are that they are structured in a way that we are able to help alleviate that. You may have an opportunity to receive transportation assistance. There might be needs for things such as uniforms or supportive services. We are ensuring that we have availability of social workers to be able to help meet some of the needs that are not traditionally met by an HR organization or HR within an organization. We want to make sure that we're setting each of our participants up for success in all ways. There's also another benefit, which is the cohort environment in which we function. And some could relate it to a buddy system. But what that does, it enables our participants to work together with folks who are having the same experience. And we all know that having someone that can share what we're doing sometimes helps us with the flow. So we're excited about that because we have folks who come into a cohort and they need assistance. You can have someone who is there to help you grow in the same journey that you're going on, but we're also excited that once they finish these programs, many of these individuals still have these relationships after they're completed. So when you go to work, you now are in a place where you don't feel like a stranger. You have the ability to be able to have a conversation with someone who knows exactly what you've done to get where you are, as well as someone who is there with you while you're moving through it. So I think it's a great opportunity for folks who want to enter into healthcare, have never really thought about how do I do it. I don't have the time to get it done. And in all honesty, there's a lot of conversation around money to be able to get it done. We know that finances can absolutely determine which way you go in your career. Well, we're very excited because the majority of our workforce development programs, I will venture to say all of our workforce development programs are debt-free. So you're able to not only get training and education and job placement, but you walk away without owing any debt. And that is something that is substantial in how we move through our society and our communities today.
Yeah, absolutely. I mean, you can have, just from going through this program, it can change the course of someone's career and eventually, essentially affect their entire life. So I really love working with these programs and working with your team on all the great work that you do. Shannon, what are some of the requirements to enter into these programs, and how would somebody go about applying for them?
So for us, again, all excitement. If you are 18 years of age, you have a GED or a high school diploma, we're absolutely encouraged and excited about hearing from you. You can reach us at our workforce development at Ochsner.org email address to get any questions that you might have. And I'll also say this, as we begin to recruit for external programs, We are present on Facebook, we are present on Instagram, LinkedIn, and every opportunity we can to be able to share with you what our partners are doing to help us get these programs going and how we're doing our recruitment, the where, whens, and the how. So we are more than excited about anyone who has those basic credentials to be able to come out and have conversations with us about what availability exists. So we're excited, and if you're willing to learn within the group environment and you're ready to commit to allied health opportunities, we're here to have the conversation.
Yeah, and I think that's fantastic. And kind of as you mentioned, you become very active when we're recruiting for a cohort. So as Rick mentioned earlier, we're going to have a career fair next week, but that will also be a great time for you to let us know if you're interested in learning about workforce development programs in the future. So that way we can make sure our team connects you to Shannon and her team, so that way you can attend one of these information sessions and then apply in the future. So thank you, Shannon. So that wraps it up for all of my questions for our panelists. It's been really enlightening to have you guys here. Y'all are such a diverse group, and you've been able to share some phenomenal insights, specifically about the opening of this new community health center, and then the Ochsner starting in the New Orleans East region to bring into this type of community total wellness for all of the community members living in that region. So we're really, really excited about that. And as Rick mentioned, if you're wanting to join the team, whether it's at this location or join Offshore as a whole, we'll be hosting a virtual career fair next Wednesday, August 19th. It's going to be from 11 a.m. to 1 p.m. You can sign up. We're going to drop the link to sign up in the chat box. And I'm going to share that information as well while we start to go through the questions. So I'm going to share my screen in just a second. But it's a great opportunity for you to connect with our team members. We're going to be featuring jobs specifically for this location, but you'll also have the opportunity to connect with recruiters about other Ochsner jobs, as well as team members of the career outreach team. If you want to talk a little bit about career planning, not sure what your next step should be in healthcare, will be accessible for you to answer those questions. So I'm going to go ahead and share my screen. So just give me a second, and then we're going to jump into the questions. The Q&A, we've gotten a lot of great questions from all of our participants. Peace. And now we're going to get into our Q&A. And let me kind of go through the questions and see. I did want to mention there was a question initially about the projected opening date of the clinic. And Kim, I don't know if you want to take that and answer that question.
Absolutely, Morgan. The projected opening is October 5th, but we'll be hiring before that, so we need to be ready to go on October 5th. So if there are jobs that you're interested in, please apply now. Because we will be working on orientation and making sure you're ready for the opening. But October 5th is the opening date.
Yes, thank you, Kim. I'm going to direct this question to Dr. Laborde. And because this is specifically about primary care providers. So it says, how will you work with other healthcare providers in the New Orleans East community who are also providing primary care?
Well, so our approach to this, as it was commented before, we want to be able to partner with everyone to be able to provide the optimal care to the people who live in the New Orleans East. So if there are other primary care practices that are over there, our focus is first and foremost to collaborate. If there's services that they need from us, we're able to share and partner with them in any which way that we possibly can. Because ultimately the goal is to be able to provide access. And so the more providers that we have in the region that are willing to collaborate and partner with us, the better it is for the inhabitants of the community. So we're looking forward to working with everyone.
No, I love that answer. And I think you kind of just speak to the community care approach that Ochsner is really taking with the opening of this health center. Thank you. We do have a question. Specifically, this is from a participant who is a licensed medical tech and a nursing student. So she's interested specifically in opportunities for allied health positions or part-time positions for students. Rick, can you speak to that right now?
I mean, again, Morgan, we have a lot of opportunities out there, and I think the best way to go about it, is really just to not wait, jump in and get connected with our team, whether that's through our online, chat feature that's available 24/7. Certainly join us at the career fair next Wednesday, or just apply for an opportunity, and one of the recruiters from our team will be in touch. We work with students all of the time, have a lot of flexibility in our schedules, and like to, provide that support. Again, we're hiring not just for this clinic, but we're hiring everywhere, and we're hiring for the long haul, not just to get us through, to Kim's point, October 5th. We're going to be here and we're not going anywhere. That's one of the hallmarks, I would say, of Ochsner, is that we've committed to being here, and we've continued to operate under very, very difficult circumstances. So now is the time to do it. Don't wait, to jump right in, connect with our team in all of the ways that we talked about, and we will connect you, to the right team based on the area that you're interested in working in, and see where we go from there.
Thank you, Rick. I appreciate that. And then this is another question specifically about openings. Will there be openings for pharmacy technicians and laboratory techs for this specific site? And this may be a Rick and Kim answer, but Rick, if you kind of want to go ahead and start.
Yes, certainly. I mean, what I can speak to for those roles in particular is that we are hiring across the South Shore right now for those roles. Not necessarily for this clinic. I'll let Kim speak to that, whether that's, in our future plan. But we definitely have opportunities, and those particular ones may be something that we'll be looking at in the not too distant future.
I agree with Rick. Right now, we'll be looking at that, but I do know that there's opportunities at St. Bernard Parish Hospital for those positions. So, and across, of course, the South Shore region. So more to come as we assess the needs of New Orleans East Clinic.
Thank you, Kim. And then we have another question from an Ochsner RN who's joining us on the call. Hi, Rachel, I see your question. Congratulations on finishing your nurse practitioner program. We will have roles open for advanced practice providers. That will be going through our professional staff services team. So we'll be happy to connect you after the call. But welcome to a fellow Ochsner employee. Let me just see if we have any more questions. I will say there's lots of comments, Shannon, of people that are interested in learning about workforce development and that they're going to be reaching out and connecting with you. So definitely seeing a lot of excitement there. So this is a great question, and I'll direct this one to you, Shannon. We have Roxana joining, saying, good evening. I have years of experience in the dental field. How difficult or easy would it be for me to transition to medical and receive consideration for a position? And I would direct that to you because I think, it might be a great opportunity for somebody to go through a job training.
Absolutely. And I'm sorry, in the beginning of the question was she has what type of training?
Experience in the dental field.
Oh, absolutely. Absolutely. We have thought about extensively how we can transition skill sets. If she has and I'm sorry, maybe she or he, I apologize, but if you have previous experience in a dental office, you absolutely would be able to transition. You have what we'd be looking for, especially as it relates to customer service and being able to assist patients in our medical assistant field, as well as patient care technician or patient access rep with some additional opportunities for training. There's absolutely opportunity for an individual with those skill sets as they come into the organization.
Yeah, thank you. Thank you, Shannon. And absolutely, and I know Rick could probably speak to transferable skills of a role like that. Do you want to jump in, Rick?
You read my mind, Morgan. I was just going to say, you know, there may be opportunities that we could consider you for right now. Again, you know, reaching out to our team and getting in touch with a recruiter would be the first step. But to, you know, just like Shannon said, a lot of the skills that you already possess, you know, working with patients on a day-to-day basis and understanding how to manage your time, understanding just the, you know, the ebbs and flows of life serving patients. Instantly transferable skills. And there are definitely a lot of roles, some of which that we that I spoke about earlier, don't require any particular certification. And Shannon and the workforce development team do a fantastic job of connecting you to those certifications when you need them for a particular role as you advance in your career. So again, you know, it's just a matter of checking out the careers page. What are you interested in doing? And look at those job descriptions. And then again, that chat feature is available to ask questions of our career outreach specialists that can tell you, hey, yeah, you're perfect. You're already qualified for this job. Let's talk more about it. Or these are the things that we would like to see to consider you for a different type of role. And that's where we connect you with workforce development.
Thank you, Rick. And then I just have one more question. I think it took off my video. But I just have one more question that we're going to answer, and then anyone else that we weren't able to answer in the Q&A, I'm going to stay on and type out the answer so we can connect with you after. But there's a question that says, I'm very interested in working for an organization that's committed to diversity and inclusion. Can you share a little bit about Ochsner Health's commitment to diversity and inclusion? And this specifically really speaks to me, so I'll kind of start my answer, and then obviously some of the panelists may want to join in. I've really been impressed with the organization and the commitment that we've made over the past few months to increase awareness around diversity and inclusion. We've hired a vice president of diversity and inclusion, Deborah Grimes, who's been a fantastic addition to the organization. She started right at the end of February and has been with us and is already making great strides of adding to her team. We're bringing on new directors of regional diversity recruitment for all of our campuses to help support those diversity initiatives and training. We also have incredible Ochsner resource groups for our diverse employees to join, or if you're an advocate of one of the resource groups, to help support the group's mission. I've been actively involved in several of those, and I cannot speak to how great an impact it's made for me as an Offshore employee. So really tons and tons of great work around diversity and inclusion, and the organization is completely committed to continuing to bring training to our employees and support a diverse work culture here at Ochsner. Did any of the panelists want to chime in on that? I know we all have that experience since we're Ochsner employees.
Well, absolutely, Morgan, and I want to speak to especially with the ORGs, our organizational resource groups. I have the pleasure of serving as vice president of our ABLE group, which is our African American group here at Ochsner, and I can honestly tell you it is both rewarding as well as it brings about opportunity for growth within the organization and understanding folks who we work with in all diverse manners. And I can say nothing more than it's a great opportunity, and our D&I efforts are very strong here at Ochsner, and I'm very proud of that.
Yes, absolutely. And I do just want to make a clarification. Deborah Grimes is the Chief Officer of Diversity and Inclusion here, not a Vice President. So, and she runs that whole office. So I apologize. I misstated her title. And I don't think we're going to be able to answer any more questions since we're short on time, but I want to just thank everyone for joining us here today. As I said, our team will stay live and kind of go through the questions and make sure that everyone who's joined us today we're able to connect with and get next steps for resources following this. Again, we really thank you for being an active and engaged bunch. And again, big thank you to our panelists for all of your subject matter expertise on these various topics. It was such a pleasure working with y'all, and we're super excited to see who joins our virtual career fair next week, and we're hoping to connect with you then. Thank you.